Hi, my name is Dr. Natalie Gunning. I'm a physical therapist with Spalding University. Today I just want to show you a simple screen. It's called the Selective Functional Movement Assessment. It was developed by a physical therapist named Greg Cook, and all it does is it gives us a screening tool that you can do at home by yourself to see if maybe you need to go see your doctor or physical therapist. Again, this screen is not in lieu of medical attention, so if you're having a lot of issues with your neck and shoulder, I encourage you to talk to your physician. So we're going to start with the neck, and we're going to go through the criteria, and I'll demonstrate it as we go along. So the first part of the test is simply trying to touch your chin to your chest. So we're measuring cervical flexion or neck flexion. So we're going to look all the way down and try to touch your chin to your chest. I actually fail this test because my chin does not touch my chest. So to pass the test, your chin needs to be able to do it, and your mouth has to be closed, so you can't cheat and open your mouth. The second part of the test is cervical extension, or looking all the way up, taking your neck back. So to pass this portion of the test, we need to break neutral by 10 degrees and then not do any extraneous movement. So no weird head motions. So I'm going to switch to the side here. So all I'm going to do is look all the way up to the ceiling. So I definitely break past neutral. I'm not having any pain. So I pass this test. I have some patients that can only get here, so they would fail the test. Next is cervical rotation. So this is looking from side to side. So important for driving cars, everything like that. So you're going to look across both shoulders, and you're trying to be in line with this bone here called your clavicle. So your chin should at least be in line with the clavicle. Bonus points if it's in the midline of your shoulders. So you're going to look all the way to each direction. And then I'll turn to the side so you can see a little bit better. So I'm up nice and tall. And then I'm simply just going to look over the shoulder. So I'm a little bit tight. Here is my clavicle. So on this side, I'm maybe not quite there. I do have a lot of issues from weightlifting over the years, especially on this shoulder over here. So I'm not surprised I'm tight. So again, technically by this standard, I have failed the cervical flexion test, and I have failed one of the rotation tests due to some tightness going on. So I might need to go see somebody about that. The next part of the test, moving on down, is looking at your shoulder. So if you have a lot of shoulder pain, numbness and tingling in your fingers, you might want to check these out. So the first one is just reaching. You're going to reach up and across, and you're trying to touch the top of your opposite shoulder blade, also known as the scapula. So hopefully you can see this okay. Might have to get down a little bit. So I'm going to reach up and across and try to touch, and I can touch it on this side. And then on this one, I'm going to reach up and across, and I can touch it on this side as well. Then we're going to reach up and back, and you're trying to touch the bottom of the opposite shoulder blade. So I can do that on this side, a little bit tighter on this side, but I can get there. So to fail that portion of the test, either you're unable to touch what's known as the spine of the scapula when you're reaching up at the top, or the inferior angle when you're reaching up behind, or any extra movement or pain in your shoulder. So that's just the top half of the functional movement assessment. I hope this video was helpful. If you have any questions, feel free to email me at ngunning@spalding.edu. Take care. Bye-bye.